Hello, and this video is about how you can heal through birth trauma and provide your own birth trauma therapy. My name is Sophie Harris and I am a pregnancy and postpartum therapist, and I run my company Looking After Mum. My mission is to make mental health support as accessible as possible for new mums during this period and during this huge transition in your life. So subscribe to my videos where you will receive free weekly support, and let's get on with the video. So birth trauma is unfortunately extremely common, especially at the moment given the last few years that we've had. I speak to hundreds of women through my social media account Looking After Mum on my Instagram, and I hear so many stories of separation and trauma and awful experiences that people have gone through which stay with them for a long time. So therefore, I spend a lot of time in my private therapy practice supporting mums who have been through birth trauma. In this video, I'm going to share 7 tips for you of how you can do this, both with yourself or with a therapist. So first tip is to let yourself cry if you need to. So many of us resist our emotions because maybe they feel too painful, but tears are good and tears are your friend, and it is so helpful to be able to cry, to be able to process what has happened, to be able to move on. Your emotions will pass. You won't stay crying even if it feels like at the time that you may do. Second tip is to give yourself compassion and be kind to yourself. Often, when we're going through the worst experiences in our life, why are we so mean to ourselves? We can find ourselves thinking, why can't I get over this? What's wrong with me? Anything negative, like I should be managing better. But think what you've been through. Try to imagine if you've got a best friend, if they were going through what you'd went through, what would you say to them? What support would you give them? And try to speak to yourself in this way. Next tip is to simply breathe. We tend to get a lot of trauma trapped in our nervous systems, in our bodies. And this can have a real severe effect on our tension in our bodies and how we are able to process things. Breathing is one of the simplest ways that we can help our bodies heal and to bring oxygen to all of the different areas of our bodies. So try to breathe in through your nose, and let's say for a count of 4, and breathe deep into your belly, and then breathe out through your mouth. Try to ensure that the out breath is longer than the in breath, as this helps to regulate your nervous system. You could try breathing in for a count of 4 and out for a count of 8, but it's not essential that you use those numbers. Just find what works for you. Next point is to educate yourself on the systems around your trauma and your experience. So often we blame ourselves or our bodies for what we went through, but I can almost guarantee that that will not be the case. Try to educate yourself on, our healthcare systems and maternity systems and all of those influences that will have gone on with your trauma. And this can help to redistribute some of that blame and help you to recognize that what you are thinking isn't always accurate when you are blaming yourself. 5 is to journal. Journaling is a really helpful way to process our memories, and it's something that you can do for yourself. To write down what happened in some level of detail. This can be really painful, but this also helps our brain to process what you've been through. This is also something that you can do without a therapist, but you could also use this as part of your therapy journey with a therapist as well. Next point is to gently expose yourself to triggers. This means when we feel traumatized, sometimes we can find ourselves avoiding certain things because we don't want to become upset. but actually it would be helpful to do the opposite. And we don't want to expose ourselves to something triggering so much that it feels totally overwhelming. However, it can be helpful to experience something and let those emotions come and let them pass. Let's use an example of this. So if I've had a traumatic birth, maybe I find myself avoiding TV programs with hospital scenes in. I avoid driving near my hospital. I avoid thinking about things. I avoid certain people who I associate with my birth, let's say. And so perhaps there might be certain things that you don't mind avoiding for the rest of your life, and that is okay. But it can also be helpful. Say if a hospital scene comes on a TV program, rather than switching that off, but just to watch it and let emotions come up and let them fade again. And I put a caveat on this because when we are very traumatized, it can feel really triggering. And so you want to get that level right. That's where the support of a therapist can be helpful. However, on the whole, it is likely to be helpful to be able to learn to manage those emotions as they arrive rather than simply avoiding them. Next tip is to look after yourself. This is hard because when we have a baby, we're healing from trauma, we're healing from birth, and you've got a baby to look after. This can feel really difficult, but try to get support where you can so you can prioritize yourself in certain areas, because self-care is so important as we heal from trauma, almost as a way of separating ourselves from our trauma. That is something traumatic that happened to us, yes, but that is not us. We are more than that. There is more to us than that trauma. And so looking after ourselves, whether that's exercising, getting dressed, like doing things that can help us, that is all part of separating ourselves from that trauma. And finally, if in doubt, seek professional support. I am a trained trauma therapist, a cognitive behavioural therapist, and I work with new mums all the time to help them overcome birth trauma. You are very welcome to use the link towards my website to find out whether I have availability and to find out more details about therapy sessions. Also, you may be able to get support via your healthcare provider. If you're in the UK, maybe via the NHS. You'd at least be entitled to an assessment. Also, Birth Trauma Association provides free peer support and other ways of connecting with new mums and partners who have experienced birth trauma. Okay, it has been a pleasure, and let me know in the comments any questions that you might have or any experiences that you've had related to this.